Mr. President, today we're about to mark a milestone, and it wouldn't be a milestone for any other group maybe except the United States Congress, and that milestone is getting a significant part of our work done on time. This will be the first time in 22 years that we've passed the Labor, Health, and Human Services Appropriations Bill before the start of the fiscal year. Just a few days ago, it was the first time in 11 years that this bill had even been debated on the Senate floor. And so we're headed in a good direction. Now, Mr. President, this isn't exactly the bill that I'd prefer. It's a bipartisan agreement. It isn't exactly what my ranking member, Senator Murray, would like to have done here. But working with our House colleagues and with Senator Shelby and Senator Leahy, we have actually done the job this year that the Appropriating Committee is supposed to do, which is to appropriate the money, to decide how to spend the people's money that we've been entrusted with. For instance, Mr. President, this bill funds things like the opioid bill that 99 senators voted for yesterday. It's one thing to vote on a bill that says, here's what we ought to do. It's another thing to then actually do it. Most of those things we voted on yesterday will not happen unless we decide to fund the things we said we wanted to do. Now, this is one of the most difficult bills to negotiate. It's 30% of all the non-defense spending. It's interestingly combined this year with the defense bill. So you've got the number one priority of the federal government to defend the country as part of the bill. That's 50% of all the discretionary spending. And then another 12% or so with the Labor H bill, 62% of all the spending the government will do that we have a choice in, that's not the mandatory spending, happens in this bill, the bill that the Senate is voting on today. There's lots of push and pull in this bill. In fact, Mr. President, our committee got 6,164 requests from senators during the committee negotiations about things they cared for in this bill. There were 31 amendments that were offered on the debate on the bill on the floor. Today's bill reflects the priorities, I think, of both sides of the Capitol and both sides of the aisle. We fulfill the commitments that the leaders made in the February budget agreement to keep the extraneous issues off these bills that fund the government. It also fulfills, by the way, the president's demand that he doesn't want any more of the omnibus spending bills. He wants these bills in small packages that we can debate and he can look at. It invests in national priorities like fighting the opioid epidemic and expanding medical research and promoting college affordability and strengthening our workforce. This bill accomplishes a huge goal that I and Senator Murray and Senator Durbin and Senator Alexander and others have had for several years now, which is to get back fully committed to health research funding. That NIH grant process that had gone, to a great extent, had gone into a stagnant, no growth mode for over a decade. This bill looks at things like Alzheimer's, where we're spending well over $200 billion a year in tax dollars for Alzheimer's and dementia care, and now we're spending 1% of that in a way that would try to find a solution. And Mr. President, if we don't find a solution, Alzheimer's disease alone, the tax dollars spent on Alzheimer's disease is anticipated to increase to the size of twice today's defense budget by 2050. Twice what we're spending today to defend the country is what we'd be spending to deal with Alzheimer's if we don't find more than we know now of ways to diagnose, ways to delay onset. If you could delay onset by 5 years, you'd cut that number by 46%. So a focus on research, whether it's Alzheimer's or immunotherapy with cancer or CRISPR technology. Young researchers are back in the business of getting some grants that encourage them to stay in research. So that's an important part of this bill. In the things we're doing with opioids, again, yesterday was about what we want to do. Today is about whether we're willing to do it or not. It continues that commitment. The Council of Economic Advisors says the cost of opioids is more than $500 billion a year. The lost work, the family trauma, the other health matters that occur, the loss of life, the #1 cause of accidental death in America today is drug overdose. This bill provides $3.8 billion toward targeted opioid funding and represents the 4th year we've increased opioid treatment, prevention, and recovery programs. One of those programs is $1.5 billion that will be divided among the states to see what they can do in their state to, again, this is not only the #1 accidental cause of death in America, it's the #1 accidental cause of death in most states in the country today. We have $200 million for community health centers to expand behavioral health and substance abuse disorders. If you don't have a behavioral health problem before you get addicted to opioids and other drugs, you certainly have one after. We increase funding to improve surveillance and prevention in all 50 states. There are extra dollars here to research at NIH pain management to try to figure out a better way to manage pain without the addictive impacts of opioids. We have a set aside for the hardest hit rural communities. On a per capita basis, rural America is much more dramatically impacted by this opioid epidemic than urban America is. There's money here for services for children at risk, children that have to be taken out of the home they're in and helped and assisted back to some normal environment where a kid can grow up as they do that. Got money here to help people enter school ready to learn, to be ready and prepared for careers and training. Certainly the apprenticeship programs here are programs that Senator Murray has advocated effectively for, both in this bill and on the floor. The bill includes an increase for Head Start, again, getting kids ready to go to school, more Title I money to support students in low-income schools and help them meet challenging state academic standards. There's an increase here for the Individuals with Disability Education Act. So students with disabilities have more federal encouragement, even though more of that burden is still borne locally than the IDEA ever thought possible when that bill was passed. There's more funding here for academic enrichment grants, for charter schools, for impact aid, for dedicated evidence-based STEM education programs, for career and technical programs. And I will say that in the 4 years we've worked on this committee together, we do have a little more funding this year than we had in previous years, but we continue to move in all those directions, I think in all cases the first 2 years, and we did that by eliminating programs and combining programs that weren't working. So this bill still reflects hard choices, things that allow people to get to college, to stay in college, returning to year-round Pell Grants, and increasing the maximum Pell Grants. As I said earlier, for the first time ever, I believe, it's on the floor with the defense bill. It's something that our leaders on both sides of the aisle thought we might be able to do. It was, frankly, by a lot of standards, a pretty bold experiment, but I believe the vote today is likely to show that it's an experiment that really makes a lot of sense. And so, Mr. President, I'm certainly urging my colleagues to support this bill today, thanking Senator Murray and others who've worked so hard to make this happen, and I would yield the floor.